Thank you, Vic, and welcome again to this ASTO Connects about implementing Healthy People 2020 and gearing up for Healthy People 2030. Today's conversation and Cup of Joe virtual coffee chat will feature both national partners and state public health agency champions to talk about how healthy people can support efforts to implement public health plans and initiatives. We will hear from 3 speakers today. Following the presentations, we will open it up for conversation. Feel free to type your questions into the chat box throughout the session or jot them down for yourself to open up during the live Q&A. This is a virtual coffee chat, so feel free to join us with your favorite mug or cup. And for those of you not familiar with ASTO, we are a national nonprofit representing the chief health officials of every state, U.S. territory, freely associated state, and the District of Columbia. Our mission is to support, equip, and advocate for state and territorial health officials. It maps onto 3 core functions. We are a leadership home for state and territorial public health officials. We are an advocate for the voice of state and territorial public health on Capitol Hill. And we are a capacity building provider to state and territorial public health officials. ASTO realizes the importance of healthy people in fostering a shared vision of public health, establishing national priorities, and guiding data collection. The inclusion of Healthy People 2020 and the state health improvement plans helped states align the evidence-based strategies and coordinate regional priorities across state lines. We have also seen states and territories utilize Healthy People 2020 to build partnerships across sectors and establish community task force to improve health outcomes. To get us started, we're going to open up a quick poll to find out when you think the first Healthy People decade started. Thank you for submitting your poll questions. Vic, if you can close the poll. Wonderful. Well, Healthy People first debuted in 1990 following the 1979 U.S. Surgeon General's report, which advocated for health improvement through a national commitment to disease prevention and health promotion. Since then, Healthy People has built a public health capacity and identified evidence-based strategies. I'm going to move forward in our slides. I can. We are pleased to welcome Ayanna Johnson from the Office of Disease Prevention and Health Promotion, also known as ODPHP, at the U.S. Department of Health and Human Services, to share opening comments for our virtual coffee chat. In addition to providing opening remarks, she will provide context and rationale for the framework, communicate the principles that underline decisions about Healthy People 2030, and situate the proposed objectives into the 5-decade history of Healthy People. With that, I'll turn it over to you, Ayanna.
Thank you, Kelsey. Can you hear me okay?
Yes, we can hear you okay.
Okay, great. So thanks everyone for joining today's webinar. As most of you know, Healthy People is a national agenda that communicates our vision for improving health and achieving health equity. Every decade, Healthy People Initiative develops a new set of comprehensive science-based 10-year national objectives aimed at improving the health of all Americans. Our initiative is grounded in the notion that establishing objectives and providing benchmarks to track and monitor progress over time can actually motivate, guide, and focus action. We like to engage in a multidisciplinary network of stakeholders at all levels and create a comprehensive strategic framework for health promotion and disease prevention. And of course, we identify and specific measurable objectives with targets to be achieved at the end of each decade. We also provide data and tools to enable states, cities, and communities and individuals across the country to combine their efforts to achieve them. Next slide. Healthy People began, as Kelsey mentioned, in 1979 with the Surgeon General's report and is the longest running disease prevention health promotion plan in the nation. Over time, Healthy People has grown to include the most critical health promotion and disease prevention topics. On this slide here, you can see how Healthy People has grown substantially since its first publication in 1990 with 226 objectives to today with over 1,200 objectives across 42 different topic areas. Along with the increase in size, Healthy People's conception of disparities and determinants of health has also evolved over time. In 2000, we first introduced the language on reducing health disparities. In 2010, Healthy People strengthened that language to say eliminate health disparities. And in 2020, we added achieving health equity as an overarching goal. And we also added an overarching goal that highlights the impact of the social and physical environments on health. Next slide. So what we're all waiting for and getting ready to launch is Healthy People 2030. Building on our previous iterations of the initiative, Healthy People 2030 envisions a society in which all people can achieve their full potential for health and well-being across the lifespan. Our framework was developed during the first phase of this development of 2030 and actually approved by the HHS Secretary in 2018. Our framework content was guided by recommendations from our Secretary's Advisory Committee for Health Promotion and Disease Prevention and over 1,000 comments from members of the public during our open public comment period. The resulting framework reflects our mission, overarching goals for the coming decade, and it also includes guiding principles and a plan of action. I want to highlight a few of the nuances in Healthy People's 2030 overarching goals. In 2030, the framework continues to emphasize that creating physical, social, and now economic environments that support health and well-being is important. Another key element for this decade is the calling out of engaging key stakeholders and constituents and groups to actually take action and design policies that improve health. Next slide. Of course, Healthy People 2030 will continue using the social determinants of health organizing framework. Although objectives related to the social determinants of health have actually been included in Healthy People since inception, in 2020, as you know, we released this social determinants of health framework, which was a pioneer effort in the federal government space. Healthy People 2020 also added the social determinants of health topic area and included these 5 key domains that you see here: economic stability, education, health and healthcare, neighborhood and built environment, and social and community context. Each of these 5 determinant areas reflects a number of key issues that make up the underlying factors of SDOH. This framework will be continued to be used in 2030 to organize our objectives and identify areas for improving health. And we also make sure that we will be including this overarching goal that reflects that in our work as well. Next slide. So, streamlining Healthy People 2030. So based on stakeholder feedback and our user studies and research, Healthy People 2030 will be a more streamlined set of objectives, reduced by more than half, that represent our nation's high priority issues. Our plan is to launch with an initiative that is easier to navigate and tailor to your needs. Healthy People 2030 will also have 3 types of objectives. Our core objectives will be measurable objectives with reliable data that have a direct impact on or influence on health, have broad and comprehensive applicability, represent an issue with substantial burden on the population, and they should actually address a national health priority or health equity. We have 2 other objective types in this 2030 initiative: developmental and research objectives. Oh, go back. 1 slide, Kelsey. Oh, I'll just keep going. So our developmental objectives will represent high priority issues that do not have baseline data, reliable baseline data, but we do have evidence-based interventions that have been identified. And our research objectives may or may not meet core objective data requirements, but they do not have evidence-based interventions developed yet. These objectives represent a significant opportunity for progress in areas with limited research. Our research objectives might also be considered priority areas for future research. These objectives in combination—
Sorry, I'm so sorry for that technical error.
Sure, no worries. I'll keep going. Our objectives in combination with the core objectives will provide a more holistic view of the important issues facing our nation's health. In 2030, we also plan to organize the objectives by health behaviors, health conditions, populations, the social determinants of health, and different settings. This will be a more intuitive organization for users. As in 2020, our core objectives will have targets that will be monitored throughout the decade. And then finally, we just wanted to use this opportunity to talk about how we are planning to design the website and think about our key users and the information needs. And of course, that's you all here on this webinar. In 2030, we will continue to be responsive to our user needs and make sure that the initiative continues to support public health professionals, researchers and policymakers, clinicians, and other stakeholders. We'll make sure that we provide information for their data needs, make sure that we help you all in informing program planning and addressing health disparities with benchmarking or conducting community health assessments or quality improvement activities, and of course, in setting policies and priorities to plan and make decisions and to build partnerships. We will continue to have features like state level maps that show where folks are actually addressing health disparities and disease prevention. We will also make sure that we have maps that can help us monitor and show progress over time and see how the country is achieving our healthy people goals. We also will make sure that these tools that we had in 2020 will be brought on into 2030, but also improved to be useful for you all out in the field. We are going to also make sure that that the initiative will continue to serve as a springboard for community engagement and action and developing cross-sector partnerships. So, oh great, the slides are back. So here you can see one of our stories from the field slides where we actually identify places where folks are doing really great work on achieving certain objectives or maybe even achieving different topic areas. So if you're on our website, healthypeople.gov, you could actually hover over any of those blue indicators and see what work they were working on and what they were doing and how they're progressing. So as we transition to the next decade, we want to be sure that we continue to provide states and communities with guidance on where to act to improve our nation's health. And that's where you all fit in, our Healthy People State Coordinator. So I'm very excited to turn now to our coordinators to talk about their work and how they're preparing for Healthy People 2030. So Kelsey, back to you, or?
Yes, thank you, Ayana. That was a wonderful overview and a great way to highlight the important work of healthy people at the state level. I apologize for the technical errors with the slides. Hopefully we'll be able to continue on without any glitches. So as Ayana mentioned, we've invited two healthy people coordinators. First, we'll be hearing from Louise from Iowa. She's the program coordinator for Healthy Iowans to talk about how the Iowa Department of Public Health has experienced using healthy people from its inception. She's an advocate and a voice for public health in Iowa, and today she will share highlights of Healthy People 2020 and her visions for Healthy People 2030 in Iowa. And with that, I'll turn it over to you.
Thanks, Kelsey. Iowa is really known recently, certainly, for its involvement in the presidential campaigns. And unless you think of Iowans as not being all that interested, they're keenly interested and feel very responsible about the candidates. They've been going now for some time across the state, and I can assure you there's a lot of concern and interest in what they have to say. I would like to think that health planning also has that role in terms of people in this state being interested and concerned about what goes on in the health of Iowans. Certainly the history of the two plans, the local planning and the state planning, is indicated that both of them started in 1990 or close to that period. The impetus for starting Healthy Iowans was really Healthy People 2000. We called upon probably one of the most eminent experts in the field of public health, Dr. Richard Remington, who was the chair of the Institute of Medicine study on the future of public health, for an initial beginning of our process. And he led us through, helped us with developing goals, action steps, and strategies, whatever you want to call them. But his stamp has continued all the way through until the present time. One of the things we ask as we looked at Healthy People is, does it fit? Is it Iowa? And based on really that question and that answer, we developed a lot of our planning. At the same time, we were working on our state health plan. Going on at the local level was a lot of activity that dealt pretty much like what we were doing at the state level. We'd like to call it today a bottom-up approach, because the work that the 99 counties have done has really formed the basis for our current health planning process. Looking at it in terms of grassroots, I'd say this is really a grassroots effort. And we adopted and looked at and reviewed the local health priorities. And if you look on the infographic, which my colleague who's helping me this afternoon, John Durbin, put together, you can see that there were a lot of suggestions, input, and identification of what people thought were the health priorities for the state of Iowa. The size of the print indicates the amount of interest and concern for those particular issues. Not only did we ask and use local health planning, we also looked at national data, of which Healthy People was certainly an integral part of that. We asked so many different groups, and when we tallied it all up, there were about 20,000 people in the state who made a contribution to building our health plan. If you counted the numbers on the infographic, you might see that there were 26 themes, of which the 3 themes are at the top of the slide. And the other 23 are really the issues that we tackled in the most recent health plan. We're currently involved in making revisions. One of the nice parts about our process is that once we've done the plan, we don't put it aside. We track it. We ask the people who have contributed to the plan, what have you done? What are your problems? What are your accomplishments? And out of that, we revise the plan every single year so it stays fresh. So it is something that is relevant to the rest of the state, or to all of the state. The 99 partners this time, they were involved in some way in contributing to Healthy Iowans. I was asked to at least touch on some of the progress that we've made. And based on this most recent report, we've seen a lot of emphasis on telehealth, particularly in rural Iowa, where access to some of the health services are much of a problem. We've also seen a reduction in underage drinking. And what is, I think, as exciting as anything else is that we've seen a drop in cancer and heart disease mortality. Now, it's not all good. We've seen, for example, that there's been a drop in the number of Iowans, low-income Iowans, who can take access or have access to family planning programs and providers. We've also noticed with some concern the increase in suicide rates. And finally, the elephant that's always in the room, it seems, is the problem of obesity. Again, we're not doing well on it, but we're still making an effort to try to make some changes. The question is, how has Healthy People contributed to our process? And I just sort of put a couple of things together on the impact that Healthy People has had. First of all, it has aligned our local and state objectives with the national objectives. So that, for example, if you pick up a plan from a small community or a small county, at the very top of their plan, you will see the connection between the national plan and the state plan. Similarly, the same thing is true of if you look at our state health plan. So that what we've done is to create a linkage from local to state and finally to the national plan. And that seems to be a pretty important step that the Healthy People has provided us. And as usual, you might expect that it's been a reference. One of the things that popped up, and Ayanna mentioned it, and that is the whole notion of social determinants. Very little was known before the most recent Healthy People plan. It really helped us understand what social determinants was and what or were, and what kinds of issues were involved in the social determinants idea. We did a crosswalk looking at Healthy People and Healthy Iowans. The themes that we selected, I would, for instance, and my colleague John would get some calls saying, well, you know, we're doing something, we've got this idea, what do you think? And one of the first things I thought of is, well, check out Healthy People. How did they frame a particular issue? So it's been a very practical kind of effort. I'd like to think, and I don't know whether it's true or not, but I certainly did encourage people to use Healthy People and to make sure that whenever they submitted a grant, that they tie whatever we're doing here in Iowa with what was going on nationally. There's one more, I'd say, impact, and it's kind of hard to put together, but I think it has helped us feel connected to the national effort. That is, it feels as if we're a part of something that's truly, truly important, and that is improving not only the health of Iowans, but through that, the Healthy People. The question is, what's in store now that 2030 is ready to be promoted and issued? And I would say, well, we've done it pretty well with Healthy People 2020, Healthy People 2000. My hunch is that probably we'll do about the same as we move into 2030. Thank you.
Thank you, Louise. I really appreciate your overview and talking about the importance of the changes over time and how your state has adapted to make sure you meet the needs at the local level and sort of moving that up to match the national objectives. I liked the maps you showed us as well and the infographic. So I'm excited to get to questions afterwards. With that, I'll turn it over to Emily from the District of Columbia Department of Health. She is their Healthy People Coordinator, and she'll be sharing with us how the District of Columbia uses healthy people to guide their planning and engage local partners. She works to monitor over 150 objectives and uses the action plan to focus efforts. Today, she will share how her health agency has used healthy people, and they anticipate using Healthy People 2030. With that, I'll turn it over to you, Emily.
Hi, good afternoon, morning, everybody. Can you hear me all right? Great. All right, well, thank you, Kelsey, and everybody who's joined, as well as Asto, for inviting us to come and speak and hosting this Cup of Joe. We're excited to talk about the work that we're doing here in the district to further our shared goals of Healthy People 2020. So here at the District of Columbia Department of Health, which we call DC Health, we're a little unique in that we serve as both a state and a local health department. We're FAB accredited as a state, but we don't have any other local or tribal health departments within our jurisdiction. We serve about 700,000 residents who live in the district, so far more than folks who just work on Capitol Hill. And the district is about 68 square miles. So we work to ensure the health and safety of our residents, as well as visitors and commuters who spend time in DC. And as well as in Iowa, the district was a relatively early adopter and user of the Healthy People framework. So I know for sure we had a Healthy People 2000, as well as a 2010. So now DC Healthy People 2020 serves as our state health improvement plan and was developed as a collaborative process that took about 9 months in 2015. We used results-based accountability to determine results, objectives, and targets for the year 2020 over 29 different topic areas. We collectively reviewed the evidence base and developed 85 recommended strategies, as well as prioritized both objectives and topic areas, publishing our own set of leading health indicators. I'd like to show, if I can, Kelsey, a little bit of my screen to show a dashboard that we created.
Yes, you can take over control.
Okay. All right, so I wanted to give folks an idea of some of the ways that we've published the data that we use in DC to monitor our Healthy People 2020 objectives. So this is an example of our leading health indicator dashboard, similar to the national plan that has 20 leading health indicators. We also developed leading health indicators based on a really robust prioritization process. So they're not exactly the same as the national indicators. They're tailored to our population and the needs of our population. So as you can see, it gives a summary of the progress of each indicator, whether we're improving, getting worse, there's been little or no change, we've met our target, or there is no data. So then you can kind of hover over and see based on the gray box how we're moving based on the circle and the color toward our target, which is the red line. So that's an example of how we've been able to use some online tools to show, to help monitor our healthy people over time. So the relationship in general that we had with the National Healthy People 2020, I would say is as a resource and as an alignment. So in addition to also using an intentional equity lens to make decisions, we use the national framework throughout our process as a resource for several different parts of our own framework. For example, participants in the process reviewed relevant national objectives when deciding what we would include, and then we aligned the numerators and denominators as much as possible where there were already similar objectives included in the national framework. And then we have quite a bit of data here in the district compared to other states and counties, but where our data were scarce and we weren't able to use a trend line to determine an appropriate 2020 target, we would use the national standard of 10% improvement, or we would adopt the national target if our data looked similar. And then lastly, we compiled evidence-based strategies for review by our working groups from several different sources, including Healthy People. When we developed our companion document, the action plan, which narrowed our focus to 4 prioritized topic areas: mental health and mental disorders, injury and violence prevention, access to health services, and social determinants of health. We use that as a jumping off point for our partners to take more accountability of improving each of those topic areas. And we publish that alongside the leading health indicators dashboard that I showed you previously. So while we've increased usage of Healthy People 2020 here in DC based on evaluations of the process, we continue to improve in several areas. So for our upcoming community health needs assessment, we're planning to publish it as a series of web pages so that it can serve as a dynamic document that is continuously updated as new data are released. Additionally, we're aiming to make community input more continuous as well. So we use the traditional tried and true methods of gathering and incorporating community feedback such as surveys, focus groups, key stakeholder interviews, but we've also launched an interactive community engagement portal called Our Healthy DC. So this Our Healthy DC is a platform that can be used for data updates and for getting information out to the community about different planning activities or interventions that are occurring. But it will also serve as a virtual place for district residents and stakeholders to create and participate in a wide range of discussions of interest, and then the content of which can be incorporated into any updates and priorities that happen within the improvement process. And then lastly, it can serve as a connection point for stakeholders to work on collective impact and share best practices. So in terms of the transition between 2020 and 2030, we really see both of these processes and frameworks as a key part of our role in DC as the Chief Health Strategist. We plan to strengthen our partnerships with important stakeholders throughout the city to create more shared, aligned objectives and priorities to ensure that every partner is playing to their strengths, identifying their role within the shared population health improvement objectives, and continuing to promote a focus on equity by tackling the social and structural determinants of health. So we're excited to see the results of the national process and plan to continue to align our measures as much as possible with Healthy People 2030. And if you don't mind, Kelsey, I'd like to show the Our Healthy DC platform.
Yes.
For our members.
I'll stop sharing and you can take over this.
Thank you. Okay, so as you can see, this is the website Our Healthy DC. So we're inviting folks to work collaboratively to plan and implement actions that support population health improvement. Right now we're running a survey for our community health needs assessment that we've released collaboratively with the DC Hospital Association. And then you can see down here there are groups that folks can join and talk about different issues that are of importance to them. And we also have a page with citywide plans. DC is a big planning city, so we have a lot of different plans that we make available to folks in one place so they can align plans and see kind of how their piece fits into different planning processes across the city. That's it.
Wonderful. Thank you so much, Emily. I really like the dashboard, and it was nice to get a sneak peek of the website itself so we can see how the groups and stakeholders can join as well. I'm excited to ask you more questions about that in our Q&A. But first, for those of you participating on the line, we have another poll for you. How do you use Healthy People? To inform state health improvement plans, to use objectives for grant applications, to reference national priorities, or other, and if you choose other, please specify in the chat box. You can choose multiple options from this list. Vic, can you close the poll now? I'd like to see the results. Wonderful. It looks like all of the options we gave are things that people are using, but most importantly, the informed state health improvement plans and reference national priorities. Thank you for taking our poll. I'm seeing in the chat box that we have a few questions that came in specifically during Emily's presentation. And Emily, could you speak a little bit more about DC's robust prioritization process and share any written materials about that process with us?
Sure, happy to. So the process for developing DC Healthy People 2020, as I mentioned, took about 9 months. And the way that we prioritized was we developed criteria. We had 4 different criteria that are outlined as well in the methodology section of DC Healthy People 2020, which I put a link in the chat box to our page that has all of our resources. So it would be in the framework link. So you can read through the methodology, but just as a brief description, it looked at the severity of the health issue, so analyzing the population level health data, severity, how widespread the issue was, how many people did it affect in DC, and then it took into consideration stakeholder input and community input. So the stakeholder input was via our final kind of come together of all the stakeholder organizations who participated in the process, involved a gallery walk where all of the objectives we'd worked on those past 9 months, topic areas were up on the wall, and people did a prioritization activity to determine which objectives and topic areas were of most priority to their populations that they worked directly with. And then the community input was via surveys and a web form where people could submit their priority areas that they would be voting for. So those were the last 2 criteria that then we developed a score for each one, and that's how we developed the leading health indicators and corresponding priority topic areas.
Great, thank you. That's really helpful. And thank you for sending the link. It's in the chat box right now. I'm also seeing a robust conversation happening in the chat box. And one of the questions I'm seeing, or comments really, is that we sometimes find it difficult to use Healthy People 2020 objectives because the data sources have limited sample sizes for the state and sub-state estimates. I'm wondering if Luis, Ayana, or Emily, if you have any recommendations or if you have any workarounds that you've found to be helpful with the smaller sample sizes in some of the objectives.
I can only respond to that question by saying that there are many different data sources that we have used. They certainly are available, one of the tracking system, so on and so forth, so that I think it's hard really to keep it current given the breadth of the number of objectives that you have. So we've just gone into other areas and other sources to find the data that works. And there are many different ones that we have suggested. That one is the community cares. There's another one on that compare all the data from the University of Wisconsin. Those are the ones that we use to help us keep our data current. Is that what you're asking, or is that the question that's being asked? How do you keep it current? It's very tough.
Yeah, I think that was a really great response, Louise. Yeah, we have heard many times that sometimes the national data doesn't get as granular as we need for subnational or local level comparisons, and sometimes that makes it difficult. But we have heard from a few states, and I'd be interested to see what DC has done in particular, but some, like you mentioned, folks have identified other surveys that allow them to track the same thing that one of our national objectives is, or they've actually pick something else that is pretty similar and they do have a data source for it. That's what we have seen, but we are aware that that's one of the challenges, but we like to think of healthy people as sort of being that overarching, these are big issues that we all should be looking at and taking effort to make changes on, but identifying what makes sense within your state or community. But Emily, I don't know if you had different
Sure.
response.
Yeah, I can add a little bit. I think what both you and Louise mentioned is useful and parallels our experience. We do use different data sources, but align as much as possible with, as I mentioned, kind of looking into the numerator and denominator and seeing what the spirit of the objective was to be able to determine how the data source we have available to us can best be utilized to measure something similar, the best proxy that we can find. So we'll use BRFIS, NISDA, and YRBS data. We also have a relationship with our healthcare finance department, and they have Medicaid data. So for some of our indicators where we've had especially hard time getting access to health services data, we've been able to use Medicaid data as a proxy for the population level. And so we get creative where we can and really lean on our partners and see what kind of data they might have from their work in the community that could support some of the objectives that are harder to find data sources for.
I'm glad you mentioned work with your local partners and see what data they have, because we have 2 questions that have come in. It looks like Barbara has joined us by video and taken herself off mute, so I'll let her ask her question. She's asked some similar questions in the chat box.
I was just really wondering about how local citizens could get involved in gathering data. My whole career, I've always worked at sort of a democracy approach to involving citizens. And so if that's a problem, that's the first thing that comes to my mind. We need to look at ways to do that.
Louise, I think it would be great if you could talk about the work that Iowa has done. I think you're muted.
Oh, if I'm unmuted, I think that certainly that's a very important question on how do you get the individual to become aware of and to get the data sources. Frequently, you can find it on our own website. We do have a Healthy Iowans that has certain advantages. We also have a China.hip source that's extremely helpful, which has a variety of different kinds of data, so that really probably the internet is the best choice.
And actually, part of what I was looking at is, and it winds up being anecdotal research, I guess, sometimes, but actually involving citizens in gathering some of the data. Take some education sometimes if you're gonna have research questions and some controls and things like that. But I don't see it done a lot, probably because it's difficult, but I still think maybe that would be a good thing. If people are, just like anything else, if people are involved in doing something, they're going to put more value in it. One of the concerns that seems to be across, maybe that's one of the social determinants, citizens don't always value the evidence-based data. But is there a way to have them get involved in gathering some data that in turn, maybe they would value it more?
Yeah, I can chime in. I think that's really an intriguing idea. And I think the ways, as I mentioned, we have few gaps in terms of data. So I think we feel lucky in that sense. And we really try to engage our community and residents to hear what they think. And so in that sense, they're giving us data about their opinions. But in terms of having them turn around and collect data on different population health outcomes in their own communities, we have a lot of academic institutions in our area, and a lot of community-based participatory research that happens. So I'm kind of seeing opportunities to leverage that work that's happening to see how we could maybe incorporate a little more of on-the-ground data that's more relevant to people living their experience.
This is Louise again. I think probably one of the best places to start is at the local level. And we've been doing, as I said, mentioned the China HIP, and we encourage communities and groups to ask the police, to ask the various sources, the judges. There are many different wonderful sources of local data, which very frankly, the state does not collect. And that could be done, especially when we're talking about counties and county health planning.
Speaking of that, we have in the chat box a contribution about data and information on community wealth building and a link to the new initiative on this process. So if you're more interested in learning about this sort of model, go ahead and follow the link that's in the chat box. I also, on that note, would like to share that we have worked with another state that what they did is they went to the Chamber of Commerce and worked with small businesses in the area to sort of identify what Healthy People was doing and where to find resources. And that was an effective strategy for them to get more community members and citizens involved, especially at the small business level. It just allowed them to advertise in a unique avenue and sort of approach people based on their own interests and needs. So that's just one other example of how you can get people involved. On the note of getting people involved, Diana, I'm wondering if you could share a little bit more about what the closeout of Healthy People 2020 will look like and what recommendations your office has for what people can do with the results and sort of monitoring their progress.
Sure. We know that, the decade is coming to a close, and at least our monitoring of Healthy People 2020. So we will be working on producing a final report, also producing a crosswalk so that it's easy to identify which objectives from Healthy People 2020 have been carried over to 2030 and which ones are pretty similar, are using different data, and where we have changed data systems. We plan to launch the initiative in the beginning of the first quarter of 2020. So, it's relatively soon. And then following that, we will be working on a final report of Healthy People 2020 so that folks can see where we have gone across the decade. But in the interim, if you're interested, we did publish our mid-course review, which looked at every single objective and topic area and where we were up to the midpoint of this decade, and that was published in 2017, and I can drop the link for that shortly.
Great. I'm seeing another link come in on the chat box. And it also says, for those of you in Texas, the Texas Policy Lab at Rice University is available to help you assess your data needs at no cost. And they've selected the link there as well, or included the link, excuse me. And I know, Emily, you mentioned academic partners being an important role. So perhaps a good first step is connecting with those academic partners. And I'm curious, we have, Barbara, thank you for contributing as well. From the Kettering Foundation and National Issues Forum Institute on great information on community participation, on determining what they value on any issue, and selected both links there. So lots of resource sharing happening in the chat box. Please do continue to contribute in our remaining minutes there. I'll pause and see if there are any other questions that people would like to ask on the line or add into the chat box.
I should, I have not a question, but something else to add. You know, I think that one thing, and that healthy people, us here nationally at the federal level, want to make sure that we do is provide the right set of resources as we move into Healthy People 2030. So your thoughts and ideas and where you could use more assistance is really helpful to us as we're still, you know, developing our rollout plan and our implementation work. So things like this that Barbara had mentioned around identifying how to get local folks involved in collecting data or thinking about partnerships with academic universities, you know, those ideas are really helpful and could be used for us to, as we develop our toolkits. And so please continue to funnel those to Healthy People. You can email me at ayana.johnson@hhs.gov or even to our generic Healthy People mailbox on our website. So please don't hesitate to give us thoughts and suggestions.
Great. Thank you, Ayana. And in our remaining minutes, I'd like to ask one more question. And we've had a conversation so far about partnerships and the importance of community engagement. And I'm wondering if each of you can give one of your biggest successes in the collaboration over the years and how that's strengthened either a policy or improved practice within your jurisdiction.
I thought I saw Louise speaking, but we couldn't hear you, Louise.
Well, I was talking to my colleague that there are so many. And as I said, we've been working with so many organizations and groups, but we've discovered that we're learning too. For example, one of the things that I did not realize, and that is that one of the actually it's a medical society, the Polk County Medical Society, has a program for people who cannot afford specialty care. So this was something that I wasn't aware of and didn't know about. And I think that it's that kind of contribution that adds so much to the process, is learning. The other thing that has also happened with at least one organization, and that is the Iowa Pharmacy Association. We've discovered that, my goodness, they have all kinds of resources and are willing to help. And pharmacists are all over the state. What better place for connections and making those resources available? It's been especially true in the area of opioids. It's been particularly true in the area of vaccinations and immunization. Those are some of the resources they are delighted to provide, but without having the Healthy Iowans process, perhaps we would never have known that these resources existed.
That's great. Yeah, I would also add for us in DC, I think some of our greatest partnerships have been how we've been able to work these past couple of years with our hospitals and the Hospital Association to work to align our needs assessments and improvement plans. So we've recently made some really great strides there. So I'm excited for the future of that and those partnerships. And then additionally, in terms of, as I mentioned, we're a really big planning city. So we've been able to work closely with our partners at the Office of Planning in the Department of Energy and the Environment, who have plans related to sustainability and the comprehensive kind of land use urban planning space, and really help them infuse more equity considerations and see their place in Healthy People, as well as see how it can inform the plans that they put out and they monitor over time. And last, we have a new legislation that's just getting started on health impact assessments. So we're excited to see how that can really spur a lot more of this multi-sector work and bring health and all policies kind of to the forefront of the work we're doing here.
Great. Well, thank you. I'm seeing in the chat box. Oh, sorry, Luis, were you going to add?
Yeah, I just wanted to say this, that building off what you were saying, Emily, we have seen a lot more activity of working together with the hospitals. The hospitals have certain requirements with the Affordable Care Act, requiring them to do certain kinds of things. And what better place than to have the local health agencies working with the hospitals. We're seeing that emerge as a result of this transition, or this particular concern, a common concern about the working with the community.
Great. Thank you, Lisa and Emily. I'm seeing some alignment with your answers in the chat box around statewide shared community health assessment, sort of aligning data, doing cross-sectoral efforts for statewide priorities, and working to really address eliminating hunger and extreme poverty at the local and global simultaneously. So I really want to take a moment to thank our three speakers, Luis, Emily, and Ayana. We appreciate your perspective and your engagement in the conversation afterwards. And thank you to all of you who joined in the chat box and on video with us to engage in the conversation. This ASTO Connects, along with others, will be archived on our ASTO website at astho.org within the next 3 business days. We'll ask that you take an evaluation before you log off to help us improve future sessions and identify areas or topics that you might want to see in future sessions. With that, I will thank you again, and I hope you have a wonderful rest of your afternoon.